Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Joseph Maroon. Dr. Maroon is a world-renowned neurosurgeon, a sports medicine expert, an innovator in concussion management, personal fitness and nutrition, and an Ironman triathlete. Dr. Maroon, thank you so much for spending a few moments with us today.
Oh, my great pleasure, Monica, to be here.
So, words that are used to describe you are renowned neurosurgeon, concussion expert, and triathlete.
Okay.
An innovator in concussion management and personal fitness nutrition. So is that how you see yourself? Is that how you thought you would be known when you were starting out on this journey?
That is an excellent question. I'm a neurosurgeon, and the Congress of Neurological Surgeons asked me to write an essay on what I thought life would be like after my residency in neurosurgery and what it was actually like. So when you ask me, I have given a little thought to this. What would life be like when I finished my residency? And I really was really intent during my residency of surviving. Neurosurgical residency is a 7-year program, and night call every other night when I was doing it, so it was survival. So when I finished, I really didn't have a good idea of what I would do. I was asked to join the faculty at the University of Pittsburgh, and I worked very hard. In fact, for the first 7 years, I worked a little too hard. And by about year 8, afterwards, I experienced a burnout episode. And now, in recent studies, the Mayo Clinic just published a paper surveying physicians across the United States and found that over 50% of physicians experience burnout at some time in their career. And this incidence is 57% in neurosurgeons, according to a recent paper. So what is burnout? You know, burnout is mental and physical exhaustion, depression, lack of interest in your work, inability to function at a level that you should be able to function. That I didn't anticipate. And within the same week, my father died. My wife and I separated after several years of marriage, and I had to quit neurosurgery. And I moved in with my mother.
You quit neurosurgery because of all of this?
Because of burnout.
Right.
My life was unidimensional. It was focused on my work.
Right.
I neglected my physical. I neglected the spiritual. I neglected my family and 2 kids because of my commitment to career. And so I moved in with my mother on a farm in West Virginia. My father had a truck stop, and he died. It was a terrible, dilapidated, ugly, dirty, filthy truck stop. And one day I was doing brain surgery, and the next week I was filling up 18-wheelers and flipping hamburgers, helping my mother save this junk heap, until about 4 months later, wondering, what's happened? What am I doing here? What's wrong with this picture?
Did you want to go back to practicing medicine or operating?
At that point, I didn't want to do anything but probably leave this earth. I mean, that's not what I anticipated after my residency.
Right.
So there was the highs of finishing and working and doing and helping and learning and publishing and waving the banner. And then this cataclysmic episode that really was, if somebody were watching above what was going on, they would have predicted it, because I was so far out of balance. I had no balance in my life. And then one day, the local banker who held the mortgage on the truck stop, I think, he called me and said, "Hey, Joe, let's go for a run." I said, "Run? I can't walk. I'm 20 pounds overweight. I get dyspneic walking up a flight of stairs." And I think he wanted to see if I was going to survive to pay off the mortgage,
oh, wow.
which is why.
Right.
But we went down to the local high school track, and I made it around 4 times. I think it took me half an hour or so.
Okay.
And I was exhausted. And that night I went back and I said, "Never again. That's it. I'm hurting. I don't like it." But an amazing discovery occurred. I discovered for the first time I slept for the first time in 4 months. So I thought, well, maybe I'll go down there again the next day. And I went 1.5 miles, then 1.75 miles, and then 2, 3, 4 miles. And pretty soon, the weight started to unintentionally go away. I started to eat the good foods instead of the truck stop food. I managed my diet. I discovered a Bible in my bedroom, my childhood bedroom, and got back to the spirituality side. I grew up with the Sisters of Charity, 12 years of Sisters of Charity, and they thought for sure I should be a priest, and but I was diverted a little bit in high school.
Because you were on the football field, I guess.
So I played football in high school, and I actually got a scholarship to the University of Indiana in Bloomington, and was fortunate to be a Scholastic All-American there. So I had an athletic background, but when I got into my residency, I did nothing.
Did you always know you wanted to be a doctor when you were a child?
No. When I went to Indiana, nobody in my family had gone to college before, so I was the first from the Ohio Valley and either side of the family, my mother or father. And I was put into a dorm with a bunch of pre-meds because I did well in high school. And I didn't know I'm embarrassed to say this, I didn't know the difference between a fraternity and a sorority when I went there, because in Bridgeport, Ohio, a town of 5,000 people and 26 dogs, we didn't, it wasn't the Greek life.
Right.
It was, again, survival. But I was put in with a bunch of pre-meds, and I had this newspaper of 2,000 classes to pick from, what I wanted to be. And they said, "What do you want to be when you grow up?" So my father wants to be an attorney, I think, to keep him out of trouble.
Is that true?
Yeah. And they said, "Well, how did you do in science?" I said, "Well, I did well in high school." "Well, why don't you sign up for pre-med? And if you don't like it, you can always drop down to law." And I thought, well, I like that. I like the challenge. So I ended up finishing up and went to mid school also at Indiana, and then subsequently Oxford University in England, Georgetown, and the University of Vermont. But I did well and went through my residency, and then had my burnout episode.
Can we just get back 1 second? I just want to know what sparked your interest in neurology at the time.
In what?
In neurology.
In neurosurgery. Mm-hmm. Yeah. Well, when I was in med school, I wasn't sure. I thought I might wanted to be a psychiatrist. I thought I understood people until I got the only F in my life in psychiatry.
Wow.
And that was because I discharged an alcoholic from the VA hospital who convinced me that he was going to go home to see his family and not touch a drop again.
And you wanted to believe him.
And I wanted to believe him. So... And then, during my internship, I rotated on the neurosurgical service. And the chief resident at the time was a man by the name of Paul Kramer, excellent teacher. And we went into the ICU. I remember it today, Robert Long Hospital in Indianapolis, and there was a very large man lying in bed. And Dr. Kramer went up to the patient and looked him in the eyes looked him in his nose, and he pointed he had his fingers out like this, just like this, looking at you. And he said, "Tell me which finger's moving." And the patient could not see either finger moving out here until they got right here. And then he turned to me and said, "What's his diagnosis?" I said, "What do you mean, what's the diagnosis? How am I supposed to know that, what he has?" He said, "Well, that's all you need to know, doctor." He said he has a pituitary tumor that's compressing his optic chiasm where the nerves cross. He now has bitemporal loss of vision. And I was just blown away by the neurological examination, how by doing this, he knew the guy had a pituitary tumor that we took out the next day, and his vision came back. So, impressionable young man as I was, I thought, gee, this could be fun. And subsequently, it has been. And I'm one of the most fortunate guys in the world, because when I had my crash, and I ran around that track, and then I ran 1, 2, 5, 7, I was like Forrest Gump running through Bridgeport, Ohio. And about that time, triathlons became more noticeable, and I thought, gee, if I learn to swim and I get a bike, maybe I can do a mini triathlon. A Tin Man, they were called at the time. Swim 9/10 of a mile, bike 25, and run 10K. So it gave me a focus to get my mind off of my own self, my own depression, my own sadness. And I signed up for this mini triathlon. And sure enough, I learned to swim because I didn't know how to swim before.
Wow.
And I finished, and it was an incredible high. And I just felt my body was coming back. I lost weight. I was thinking again. The depression lifted. My cortisol levels were down. You know, the typical thing that happens with getting over it. So clearly, physical activity, physical exercise is the best antidote for depression, if you can do it. So I subsequently ended up going back to the university and back to my profession. And since then, it's been kind of a trajectory.
Did you learn how to keep the balance?
I did. In fact, this week, a book is being published entitled Getting Back to Square One, A Simple Guide to a Balanced Life.
Congratulations.
And it took 10 years to write it, thinking of just what I'm telling you. And I gave a talk. I was president of the Congress of Neurological Surgeons, which is the largest group of neurosurgeons in North America at the time. And I chose as my presidential address the title From Icarus to Equanimitas. And if you recall, Icarus was the mythological figure who escaped with his father Daedalus and flew out of the prison with wings made of feathers from the birds and wax. And he soared too high, too near the sun, where the wax melted, and he plummeted into the sea and died. In fact, the island of Icarus in the Aegean Sea is where he is supposed to have fallen. But it's really the story of an unbalanced life, of not seeking the Aristotelian mean between two extremes, and of hubris, of overly inflated pride and ego, and soaring, and you burn up. But he was also warned by his father not to fly too low, lest the waves wet his wings and pull him into the sea. So the balance is hubris versus depression. Hubris with your successes, depression with your failures.
So let me ask you.
Hard to maintain that balance.
Do you have any regrets from what you went through and all the losses you sustained?
That's another excellent question. I've been asked that before, and I've thought I've gone through some really difficult things. I've lost a son, 21, auto accident.
Oh, I'm so sorry.
Gone through some other personal issues. That I regret. But all the other adversity, I think there's a saying that adversity is the best teacher.
Right.
And we learn from adversity. We learn from stress of the body, stress of the mind. And I think the horrible adversity, like Nietzsche said, that which does not kill me makes me stronger. And I think that's true. It's just you never wish it on anyone or myself. I wouldn't want it again. But I think very valuable personal lessons have learned that's made me, I don't like to say more humble, but I think I recognize mental problems as well as physical problems. And Shakespeare had a great saying. He said, Othello, the wife of Othello, I believe it was, said, "How does one pluck from memory some rooted sorrow, erase the written troubles of the mind, and cleanse the bosom of that perilous stuff?" He was asking the physician. The physician said, in that, the patient must minister to himself.
Right.
So 2 days ago, I operated on an 84-year-old man who had terrible spinal stenosis, a paralyzed leg from a big ruptured disc. And I took an hour and a half and did what I needed to do and decompressed the spinal cord, took out a fragment of disc. He woke up, his foot's moving, his leg's moving, he's walking, he's going home today. And it's a, it's a real gift to be able to do that, which is why I'm still doing it. But I thought of a friend of mine who's suffering from severe depression and has terrible anxiety and fear of so many things, and how I would love to be able to pluck from memory that rooted sorrow and erase the written troubles of his mind.
Invite him to the track. By that, I mean the high school track.
And and that's exactly right. That's exactly right. It's and that's why, getting to the A4M, what's the value of the American Academy of Anti-Aging Medicine? It's everything that I'm talking about. What am I talking about? I'm talking about physical fitness. I've now done 8 Ironman triathlons.
Unbelievable.
5 in Hawaii. And the last full Ironman was 3 years ago with Heinz Ward, who was a football player for the Steelers, and he and I did it together. And I told him I was going to kick his butt beforehand because he had never done one before. But he beat me. I only spotted him 37 years.
Unbelievable.
And so this past July, I won my age group in an Ironman triathlon in Indiana, which I'm kind of proud of.
You should be proud.
I don't mean to boast too much.
But it's true, you should be proud.
But the point is, it's the physical activity
Right.
that I do, not to impress anybody, but to manage my own life, my own balance. Without it, I go down. So it's essential. Then what's the other is nutrition. At this meeting every year, I've been coming to the A4M for 15 years or so, and I learned today Dr. Perlmutter is just a brilliant, good teacher, doctor, neurologist, and he and I have become friends. And the lives that he touches, untold numbers with his books, his presentations. But he said the same thing we're talking about. It's what a little plug for my book. It's to balance your life, you have to have your work, your family and social side on each side of the square. You draw a square. Your spirituality and your physicality, your physical. And you need to draw a line commensurate with how much time you spend on each one of those. My line when I was burned out was all work. Then I was able to elongate the physical line by running, the spiritual line by getting back to my roots, and then the family and social side came back. And I got back into a balanced life. So what this is, to boil it all down, the A-Firm, what's the A-Firm all about? It's about seeking balance in people's lives, homeostasis. And the speakers, the exhibits, I learn every day, every year I come here. It's a great learning experience.
When you're here, you're surrounded by like-minded people. What do you say to the physicians, your constituents, that haven't joined the crusade, so to speak, that haven't found the balance or found what this type of medicine, how they can benefit from this?
12, 15 years ago, I was an outcast, more or less. Outcast. It was kind of a nut. What's he doing talking about nutritional supplements and balanced diet, and maybe we shouldn't have nothing but carbs? Maybe the government was wrong in telling us that a high-carb, low-fat diet was the best diet. And I was an outlier. Mm-hmm. Now, mainstream medicine has kind of caught up to prevention and the importance of prevention. Hippocrates, the father of medicine, 450 or so BC, said, the first responsibility of a physician is to prevent disease. If that be impossible, to cure it. If that too be impossible, to relieve pain. So what do 95% of physicians spend 98% of their time doing? Prescribing and fixing cars after they're broken. There's very little effective preventive medicine, which results in trillions of dollars of excess expenditure that's really preventable. I didn't get any of this in medical school or even afterwards. Coming here with like-minded people interested in their own health, but also in a better way to take care of their patients. When I say better, more holistic approach, including mental and the psychological and the mental component. It's exciting for me. It's still, I love learning. I love what I do.
Who inspires you?
I'm thankful. I had many, many people who inspired me, from the coaches who coached me in Little League football, my high school and college coaches, teachers, great professors at the University of Indiana, at Oxford University in England, University of Vermont and Georgetown. Very, very, not only brilliant, but good human beings.
And today, who inspires you?
And today, who inspires me? Again, it's by different groups. I've been very fortunate to work with professionals, the Pittsburgh Steelers, for 30 years. The owners, the Rooneys of the Pittsburgh Steelers. It's the most phenomenal sports family in the United States. And I see their modus operandi is one of integrity, not compromising on rules, doing the right thing at the right time. So, again, I'm in the fourth quarter.
What's your bucket list look like? You've, from what I've read, you've just climbed Mount Kilimanjaro as well. You can add that to your CV.
I climbed Mount Kilimanjaro.
It's incredible. What's left to do?
No, I think it's every day. I really. There's a story of the man who was being chased by a tiger, and he came to the edge of the cliff, and he looked down 3,000 feet to the rocks below, and he saw the tiger charging this way, and there was a tree sticking out of the side of the mountain, and he shimmied down. He's holding onto this tree. He's looking down and he's looking up. He knows he doesn't have much time to go, but there happens to be a big berry on this tree. And he reaches out and he puts the berry in his mouth and he tastes it. And it's the most incredible, sweetest berry he's ever tasted in his life, because he knew it was the last thing he was going to taste. And, I guess I look, the saying carpe diem. And there was a recent great book by a resident, neurosurgical resident at Stanford University, who discovered in himself lung cancer his last year after 10 years of neurosurgical residency. And the title of the book is When Breath Becomes Air. It's a very, very good book to read. When Breath Becomes Air. So I'm sensitive to where I am. You've
got so much time. How many triathlons are ahead of you?
I've signed up for 2 next summer.
That's wonderful.
But again, I'm a realist also. So I want to, like Abraham Lincoln said, I want to do the best I can, the best I know how, and keep doing so until the end. If the end brings me out all right, 10,000 angels saying I was wrong won't matter. So that's how I feel.
So what do you want your legacy to be?
I think, neurosurgery is an art form. And I look at every patient that I operate upon or interact with. It's like a sculpture. You remember Michelangelo when he was commissioned by Lorenzo de Medici to go do the Pieta or the David. He would go to the quarries around Florence, and he would select a big block of marble, and he'd sit there for days at a time staring at that block of marble. And his students would come and say, Master, we must get on. We have to get on with the sculpturing. And he would say, sculpturing is the easiest part. He said, we simply remove the stone from the image that is in the block. He says, it's seeing what's in the block of marble that is the difficult time. And that's what neurosurgery is. We look at MRIs, we look at CAT scans, we're looking at the pathology that's in the brain or in the spine or in the back. And the neurosurgery is the technical aspect of removing the tissues in such a way that you don't disrupt anything eloquent or important to get to the pathology, and do it as in a minimally invasive way as possible. And to be able to do that, and to be able to do it successfully, for the most part, is like creating a statue myself every day. So my legacy is, I guess, my patients, the people that I've been able to help in a positive way. My legacy is the students and the residents that I interact with and hopefully convey some sense of balance to them so that they carry on in their own way. My kids, my family, is what I don't think I could ask for anything more.
Thank you.